In this video, we will learn about public health response in community following detection of suspected diphtheria case.
Diphtheria case present with mild or moderate fever, sore throat, swelling around neck, difficulty in swallowing and breathing.
Vaccination with pentavalent at 6, 10 and 14 weeks, DPT at 16 to 23 months and at 5 to 6 years, and TD at 10 and 16 years of age prevents diphtheria.
The entire process of an efficient public health response is divided into 4 interlinked steps of public health response. An active case search is done in the community to find out the suspected diphtheria cases. Throat swab should be collected from the suspected cases and treatment should be initiated. Contact tracing of people who come in contact with suspected or confirmed cases. Antibiotics prophylaxis to all these contacts is the next step, and then immunization of all the unimmunized and under-immunized person with age-appropriate diphtheria containing vaccines like pentavalent, DPT and TD.
We will learn the public health response through a case study.
2 suspected diphtheria cases from Rampur village have been admitted in the district hospital. Within 48 hours of information about the cases, the medical officer in charge of Rampur Primary Health Center has initiated public health response measures in the village.
Active case search.
Through proper microplanning and training of ANMs, ASHAs, lab technician and supervisory staff, an active case search was conducted. The team visited all the 240 households of the Rampur village. Division of houses amongst the team members has been done using polio microplan. Each ANM or staff member were given responsibility of approximately 50 households in a day. The team visited all the households and marked the visited households with house number and date. The logistics for sample collection and shipment like throat swab, tongue depressor, Amy's transport media, sample shipment carrier with ice packs arranged beforehand along with the lab technician. The active case search team were properly equipped with training on VPD ACS format, suspected case definition, identifying and tracing close contacts, and also identification of unimmunized and under-immunized children or people. While conducting active searches, the teams were trained to look for cases in all age groups.
Let us learn about the VPD ACS form.
Collate information on demographic profile of the community, details about the suspected diphtheria cases, rapid assessment of pentavalent, DPT or TD vaccine coverage in less than 15 years age group, and details about the contact. During active case search, for suspected cases, that is cases having laryngitis or pharyngitis or nasopharyngitis or tonsillitis and adherent membranes of tonsils, pharynx or nose were found. Throat swab were collected from each of the suspected cases and sent to the district immunization officer's office.
Contact tracing.
Close contact of suspected diphtheria case include caretakers, relatives, sexual contacts, fellow students and friends. Medical staff exposed to the case's oral or respiratory secretions or exposed to the wounds should also be monitored.
Management of contacts.
The close contacts should be closely monitored for signs and symptoms for 10 days from the date of the last contact with the suspected case by the frontline health workers to ensure timely diagnosis and case confirmation. During active case search, 15 close contacts were identified by the team. Prophylactic antibiotics were given to these contacts.
Erythromycin, 40 mg per kilo body weight in 4 divided doses for 7 days, or azithromycin 10 to 12 mg per kilo body weight in single dose for 5 days.
The surveillance staff monitored contacts through daily telephonic communication with them to find new symptoms. The number of contacts who received and completed their prophylactic antibiotics were entered in VPD ACS form as well as in the case investigation form. Un- and under-immunized children below 7 years should receive age-appropriate pentavalent or DPT vaccine, and contacts above 7 years who have not received diphtheria-containing vaccine in last 5 years should receive a dose of TD vaccine.
Immunization of susceptible person.
During ACS, 5 children less than 1 year were found to be due for pentavalent and 12 children in the age group of 1 to 7 years were due for DPT vaccine. A vaccination session was planned in the villages, and all eligible children and adults were vaccinated with the age-appropriate vaccine. 20 contacts above 7 years were found to be not received any diphtheria-containing vaccine in last 5 years were given TD vaccine at the session site. Number of susceptible persons receiving at least one dose of the diphtheria-containing vaccine were entered in the VPD ACS form and the CIF. After 15 days, MOIC sent a report on public health interventions done in Rampur village. The prototype of format can be seen here, and summary were filled in this way. 240 households visited. 4 suspected cases were found. 15 contacts were identified, and all 15 received prophylactic antibiotics. 5 children received pentavalent vaccine. 12 received DPT vaccine, and 20 persons received TD vaccine. The case fatality rate from respiratory diphtheria has been 2 to 20%. Timely public health response following detection of suspected diphtheria cases can prevent morbidities and mortalities in the community.